Hi, welcome to Kentucky Partnership for Families and Children Incorporated. I'm Carol Cecil, Executive Director for Kentucky Partnership for Families and Children, and I want to share with you some of the ways that KPFC works to assist children and youth with behavioral health challenges through our trainings for parents, our trainings for transitional age youth, which is teens and young adults that have behavioral health challenges, and some of the trainings that we offer to providers or those professionals who provide services to our families and their kids. KPFC has a multitude of awareness trainings that we do. An awareness training is a 2 to 3 hour training, and it can be for parents, transitional age youth, or providers. They are trainings that can be tailored to meet the needs of the audience. These are a fee for service, $100 per training hour, plus travel costs at the federal rate to help KPFC continue to meet the needs of these families. Trainers are KPFC staff, KPFC parent and youth leaders, board members, and other folks who work with KPFC to educate those around us. The next two slides have a few of the awareness trainings. You can see that they're broken down according to who the audience could or should be, or a combination of who the audience can be. The first one is on adolescent issues. When our nice, sweet kids reach those teenage years, sometimes they're a little more challenging, and some of our kids that were already challenging become even more challenging. So this focuses on what is the developmental need for teens, and what are strategies that as parents and as providers you can work to help your teens through those very challenging years. There's advocating, learning how to advocate appropriately for yourself and for your child and your family, knowing how to advocate without injury. The next one is Baby Love, and that's focused on fetal alcohol syndrome. This is a curriculum not developed by KPFC staff, but we do have 2 staff members specifically trained in conducting this training. Better Understanding Behavioral Health Challenges is just what it says. It looks at 5 to 6 very common behavioral health challenges depending on the audience that we're serving, and it just kind of helps you look at certain symptoms, and strategies for dealing with those certain behaviors and symptoms. Creating a family-driven and youth-guided system of care focuses on how do we build a family and youth network, and how do we bring family and youth leaders into the ball game with us and getting appropriate services for our families and kids. Early social emotional development, birth to 5, is just that. Why is social emotional important for young children? How does it affect their future learning? And what do parents and providers need to be aware of for these kids? Educational advocacy focuses on Individuals with Disabilities Education Act and 504 plans, so that parents and providers can understand what are the differences, where are the gray areas for advocating, and what is an appropriate way to advocate within a school system. This next one shows some more of the awareness trainings, engaging partners, parents, and our youth, and this looks at how to strategize specifically when you're working with someone that has a challenging personality or challenging behaviors. And this could be somebody that you're trying to partner with for your child or for the children that you serve, and understanding how to be strategic in building that partnership can be critical when you're trying to meet the needs of a child and a family. Launching your transitional age youth or young adult. As our children get older and it's time for them to start learning to be out on their own, getting close to 18, 19, 20, parents need to know what is our role when our kids are 12 and 13 to get them ready for when they turn 18, so that they are ready to live out on their own. My Story, Successes and Challenges. That's one that one of our staff member does, and she shares her personal story of success and challenges in growing up and dealing with a behavioral health diagnosis. Parenting or working with a child with bipolar disorder, reactive attachment disorder. Both of those focus on the symptoms and the behaviors that come along with a child that has one of those diagnoses, and those are both done by a parent or parents who have raised or are raising children that do have the diagnosis of bipolar disorder or reactive attachment disorder. Question, Persuade, and Refer is a suicide prevention training, and it is a curriculum not developed by KPFC staff, but we do have multiple staff members and parent leaders and youth leaders that are trained as trainers to be able to help you know what to watch for and help you to understand how to handle when you think someone might be contemplating suicide. Substance use and co-occurring disabilities. We know that substance use goes hand in hand with mental health disabilities, and that's what we call co-occurring. This training focuses on symptoms to watch for, behaviors, and an understanding of the substance abuse system. It's very different than the mental health system, though it shouldn't be, it is, and helping parents to understand how to work through that and the blame and the shame that comes along with that. Surviving challenging behaviors is a generic look at common misbehaviors children have, why they might be having those misbehaviors, and strategies for meeting the needs or helping to change those behaviors. The Other Side of Youth Perspective is a group from KPFC's Kentucky Youth Move chapter, and they present their own skits and then do a panel presentation to share their stories and their perspectives of being a youth that has grown up with a diagnosis of a behavioral health challenge. Transition to Independence model. This is based on a national model, and it is for those youth who are transitioning to independence and to being grown up. We have other workshops that we do, When Tough Love Hurts, and other things like that, engaging dads that are new. And so if you do not see something on this list, but you have something you'd like us to see if we can do, please call our office or contact us. If we feel like we have the expertise or can find someone with the expertise, we will help get that together for you. If we don't, we will refer you to the place we think will best be able to meet your needs. And we have many conferences and events. Every June we have our annual Youth Parent Conference. It has 3 tracks, one for younger youth, one for older youth, and one for parents. It's held on the weekend, and currently that only costs $25 per family. And in the past we've been able to get all that funding from different grants and contracts that we've had. This year, for 2014, we will need to find sponsorships for that. So if you're interested in being a sponsor, please let us know. Becoming a Love and Logic Parent. This is a nationally recognized curriculum. It has a strong video base to it. It is 12 to 14 hours long, and KPFC will come and train it for your parents, and we can work out how those 12 to 14 hours are arranged. But if you're interested in that, it has information, just kind of what's common sense parenting, how to become an effective trainer. This is a 2-day training or a weekend training that KPFC provides for our teenagers, young adults, and parent leaders who want to know how to become an effective trainer. Coaching outside the box. This is for those folks who are coaching, mentoring, managing, or supervising other people within their position. We work using the leadership practice inventory, utilizing that and utilizing the leadership practices. We look at ways to build your coaching skills so that you are a more effective leader. Other conferences, we have our Early Childhood Family Conference, which usually happens in the fall, and it's for parents that have children birth to 5 years old who are having some type of social emotional delay or just something doesn't seem quite right. It's for them and their families, and currently it's no cost to the families. But again, starting in 2014, we will need to be able to find funds to support this conference. The Kentucky Family Leadership Academy is a weekend conference currently held 2 to 3 times per year, and it's for teenagers and young adults and the parents of any age child with behavioral health challenges to come and learn how to be a leader, learning how to advocate without injury, and how to be a better partner on your child's team and on committees within your community. The Kentucky Family Peer Support Specialist Core Competency Training takes those parents who have attended the Leadership Academy and are interested in becoming a peer support specialist. It is an application process, and they can apply for this 5-day training, and it focuses on the core competencies that a parent needs in order to move from being a parent that advocates just for my child, but a family peer support specialist who provides peer support, advocacy, direction, mentoring, coaching to other parents that are raising children with behavioral health challenges. Motivational interviewing, really this is conversational, using motivational interviewing for conversation. KPFC has adapted this training, and it can be adapted to the length of time that you need, from 3 to 6 hours, and focuses on how do you use motivational interviewing, open-ended questions, reflection, affirmations, and summaries to help be open and to build relationships with the people that you serve and that you work with. Wraparound Philosophy and Practice is also a training that KPFC has staff members who are experts on using the wraparound model and the wraparound philosophy, and they understand how to help parents know what to expect when they are receiving services that utilize the wraparound philosophy and wraparound model for their children. For more information, please contact KPFC at 1-800-369-0533 or contact me directly at cwcecil@kypartnership.org. Please come on our journey with us and help parents learn what they need to be able to best meet the needs of their children. Thanks, and have a great day.